The sensory support service begins its journey with a deaf child and its family when the child is around 6 weeks old. The Universal Hearing Screening Programme means that babies are screened for deafness at birth, and where a hearing impairment of any significant degree is found, audiology staff at the Freeman Hospital refer them straight to our team for follow-up and intervention. This early intervention work is at the heart of our business, and we are judged upon the quality of it via a rolling programme of quality assurance within the health service. Babies who have a permanent hearing loss are likely to be fitted with hearing aids by the time they are 6 weeks old. Acquiring spoken language is dependent on the ability to hear the speech of others, and without access to this, children are vulnerable to experiencing a delay in communication, ultimately struggling to develop spoken language. This compromises access to the curriculum as they enter school. By working continuously with families and babies as they move into toddlerdom and beyond, through the careful management of hearing technology and highly skilled intervention, the achievement gap is minimised even before the children hit school age. Without it, deaf children run a high risk of entering school with language levels mismatched with those of their peers, and therefore of requiring high levels of additional support. Children are encouraged to wear their hearing technology all the time in optimal working order, and thus will receive a consistent auditory message. Parents are encouraged to manage this and to recognise the earliest signs of responses to sound. Often the confirmation of deafness in a child leads to parents lacking confidence in their ability to notice things, and they are sometimes unaware of the smallest signs that indicate that a baby is hearing. By working in homes, usually on a weekly basis, our teachers can help to develop confidence and thereby allow parents to regain control of the situation. In partnership, we will provide information to hospital staff which confirms or contradicts what is gleaned in clinics and allows fine-tuning of the hearing aids. For children who are profoundly deaf, this careful monitoring will allow swift referral for cochlear implant assessment, an often lengthy process. Outcomes for children with cochlear implants are unequivocally improved by early intervention, i.e. before or around the age of a year. By being involved with families and babies from birth, we are able to monitor and instigate these referrals as early as possible, thus bringing us closer than ever to the goal of even our profoundly deaf children entering school with communication and language skills that are commensurate with their peers. We work with parents on developing attention and listening behaviour consistently. The language-rich environment of the home is conducive to learning to communicate where everything is child-led and closely bound to important routines. That of school can be different due to the demands of curriculum delivery, and our work in the early years is about maximising the experience of deaf children to equip them to continue to learn once they reach school. We will work carefully on specific aspects of communication, informed by monitoring and development of early skills, and then the understanding and use of spoken or sign language. For the majority of our children, mainstream school is the preferred choice of the families, so the goal is supporting and facilitating development to allow this to be a reality. If additional needs are identified during the preschool period, we can refer to the relevant services. As children approach entry to the early years foundation stage, everything is organised to allow a successful and easy transition. Our teachers prepare child and family for what is to come and also work with the chosen school. We offer a number of meetings with school staff, an inset to the whole school or to selective staff as deemed appropriate. This will cover background information on deafness and its implications, along with specific information on the individual needs of the child in question and ways in which these needs can be accommodated. Generally, the teacher who has worked with the family previously will continue to do so as they move into school in order to ease the transition, provide consistency, and allow the optimal flow of information.
My name is Helen Brown, Head Teacher of Shankly Primary School in Cramlington. Isaac is a hearing impaired student, now 4, and he started Shankly Primary in Easter 2012. He is profoundly deaf with bilateral cochlear implants. Prior to starting Shankly Nursery, an initial meeting between the teacher of the deaf and the nursery leaders was set up. Training was offered to all school staff and delivered to the EYFS staff before he started. This was planned to raise awareness of Isaac's needs as a profoundly deaf child, his equipment and teaching strategies. Joint training was carried out with the teacher of the deaf from the cochlear implant programme, and this focused on the equipment. From a technical point of view, help was given to set up the classroom-based sound field system. The ongoing package of support has included weekly visits from the teacher of the deaf, assistance with monitoring Isaac's progress with speech and language and other learning goals. There's been direct one-to-one teaching, ongoing training of a learning support assistant, ongoing support for teaching staff, liaison with the cochlear implant programme, liaison with home, participation in the inclusion wheels and statutory assessment processes. The support of the sensory support service has been invaluable. It has facilitated a seamless transition into preschool for Isaac. Isaac has received a specific learning package tailored to his individual needs. This has nurtured his strengths and interests, but importantly enabled him to assimilate quickly into school routines. Clear behaviour management strategies were established from the outset. Isaac has been pre-tutored to assist with his speech and language development and communication. Isaac's attention, concentration and listening skills have progressed significantly. His ability to work in paired, group and whole class situations and take turns has improved hugely. Working in partnership with the sensory support services has been an extremely positive experience for all at Shankly Primary School. Isaac has successfully integrated into mainstream school because of the outstanding support and guidance offered by the specialist teachers.
In summary, the sensory support service works in the early years to help families adjust to a diagnosis of deafness, thus improving the emotional well-being of child and family, develop early communication skills through the use of well-fitted and appropriately used hearing technology, support families to make informed choices about their child and school placements, monitor listening language and speech development, working towards age-appropriate skills, and supporting transition to school to facilitate full and effective inclusion.